Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Time once again for the weekly update. Well, it's now 3 weeks since Easter gatherings, enough time to see where that has left us. And in this video, we'll see the country is a mixed bag, and so is Western North Carolina. And the effect of vaccination is starting to show. So please share this with someone you care about. Around the country, 12 states now in the red. That's down from 15 last week. Rhode Island and Michigan vying for the highest rates. Other than Central Oregon, which is a pretty sparsely populated area, and Central Colorado, most of the West is free of red areas. Compare that with the Northeast, the Upper Midwest, and much in Florida. Our neighboring states, Tennessee up, especially red now in the central part of the state. South Carolina down a little still. And Georgia, note only one county now in the red. For North Carolina, hospitalizations and deaths continue to climb, but cases are leveling off, and that's a good sign because hospitalizations and deaths usually lag cases. 14 counties in the red, that's up from 12 last week, and 14 in the yellow this week compared with 15 last week. In Western North Carolina, go figure, we have 3 of the lowest rates in the state, Jackson, Madison, and Swain, right alongside 3 of the highest 7 rates in the state. Cherokee back in the red this week to join Transylvania and Macon having the second highest rate in the state. It's a mixed bag here, just like it is in the country. And note also Madison with a decrease down into the yellow. Henderson continues to decrease, and Graham an increase up into the orange. As far as testing, of course 5% is the important threshold. North Carolina at 5.1%. Haywood County, 5.2%, down from 8% last week, and Jackson, 5.1%, down from 7.4% last week. And notice that Buncombe had an increase both in cases and test positivity over the past week. As of Friday, Haywood County has had 4,233 positive cases in the pandemic. That's an increase of 48 over last week. And although we see a good trend down here since our high of 79 week over week about 10 days ago, we seem to have plateaued at this new level. We remain in the orange, and in the state alert system, we are listed as substantial spread. Additionally, the school system reports 3 new cases this week. That's 7 since returning from spring break. And we are starting to see the impact of vaccinations. Of the last 100 cases, only 8% are in those older than 65, the age range most vaccinated. And now a full 60% are between 18 and 50. That's a marked increase in this age range, and who've had the least opportunity to be vaccinated. No new deaths officially recorded this week, although we know of at least one with documentation pending, and that in a person under the age of 50. So what does all this tell us? Safe to say, we did not see as big a bump in cases after Easter and spring break as we were concerned might happen. But we still saw an increase, and we're still well above the baseline of 2 to 3 new cases per day, less than 20 per week, which is our aim. And we have seemed to have plateaued at this higher level this week. We'll see. We've seen plateaus before, so we'll see what happens there. Some parts of the country are doing well, others are just mired in widespread infections. And all through this pandemic, we have had moments where we get very close to what we all want, to be able to safely gather together again, only to relax too early and backslide, whether that's relaxing official recommendations or relaxing our own personal practices. Vaccinations are starting to have an effect here, as our spread in cases now is among younger people, some of whom have had the biggest concerns about vaccination. Roughly 50% of Haywood County has had at least 1 dose. Each person vaccinated gets maximum benefit 2 weeks after their second dose. But for all of us in the community to get the full benefit of vaccination, where we can stop having to wear masks and stop having to distance, we need to be at least around 80%. The gap is smaller than ever, but the gap remains. So I know each of us will make our own choice. And I've been straight with you all through this pandemic. And if you are hesitant, I ask you now to be straight with me. Be sure that your reasoning includes all the reasons vaccination might be the thing to do, alongside all the reasons that you have concerns and may be hesitant. Take the time to balance what's more risky for you, getting a vaccine or getting COVID, and what's more risky for those you care about. And if it is helpful, check out the series I've just started entitled Why Even Consider Vaccination. So be well and be careful, especially right now.